Theophylline and alcohol. What is theophylline? Theophylline is a bronchodilator, a medication that helps open the airways in conditions like asthma and chronic obstructive pulmonary disease or COPD. It relaxes smooth muscles in the lungs and improves breathing. But did you know that mixing theophylline with alcohol can actually be harmful? Let's explore why. A drug-food interaction happens when what we eat or drink change how a drug works in our body. This can lead to reduced effectiveness or worse, dangerous side effects. This interaction can affect a drug's ADME, that stands for absorption, distribution, metabolism, and excretion. The most important one here is metabolism. Theophylline is broken down in the liver by an enzyme called CYP1A2. Here's the issue. Acute alcohol use inhibits this enzyme, which means the drug isn't broken down fast enough. Meanwhile, the chronic alcohol use does the opposite. It speeds up the enzyme, clearing the drugs too fast. This kind of interaction is called enzyme inhibition or induction, and it changes the drug levels in the blood. So, in short, absorption no significantly change. Distribution may vary slightly with liver function. Metabolism slowed by acute alcohol, increased by chronic alcohol. And lastly, excretion unchanged, but less relevant if the drug is never properly metabolized. Clinical consequences. When theophylline levels get too high, patients may experience nausea, vomiting, insomnia, tremors, heart palpitation. In several cases, it can lead to seizures or irregular heartbeats. And low theophylline levels due to rapid clearance can cause asthma symptoms to return or worsen. Real-world example. Let's say a patient named Abu takes theophylline for asthma. One weekend, he drinks heavily at a party. The next morning, he experienced rapid heartbeat, restlessness, and vomiting. At the hospital, they find his theophylline level is dangerously high. It's a classic case of acute alcohol interaction. So, what can patients do? First, avoid alcohol entirely when taking theophylline. Report any sign of side effects like shakiness or insomnia. Keep up with blood level monitoring if theophylline is prescribed long term. Don't skip doses or double up after drinking. Are there alternatives? Yes, there are safer alternatives for asthma management that don't interact with alcohol. First, inhale corticosteroids. Second, long-acting beta agonists. This can be considered for patients who are unable or unwilling to avoid alcohol. In summary, theophylline helps asthma, but only when used safely. Alcohol, both acute and chronic, interferes with theophylline metabolism. This can cause either toxic effects or treatment failure. Thus, patients must be advised clearly. Avoid alcohol, monitor levels, and stay safe.